This morning we have something a little bit different, and we're going to be talking about the KASH Conference. That is KEMRI Annual Scientific Health Conference that started yesterday and ends tomorrow. We'd like to find out what is the objective and what are some of the findings of what is coming on board. Joining me to have that conversation, we have Professor Sam Kariuki, who is the Head of Policy and Research at KEMRI. Good morning, sir, and thank you for joining us.
Thank you very much for having me here.
All right, let's start with the objective of this conference and maybe just giving us a little bit of info what the KASH Conference is all about.
Thank you very much for having me here this morning. The KASH Conference is actually one of the main annual conferences that we hold at the Kenya Medical Research Institute. It's a dissemination forum for our research outputs that we intend to inform the public about what KEMRI is doing in terms of addressing some of the key health issues that pertain to this country. It started off way back when KEMRI was formed in the 1979. At that time, it was called the KEMRI-KETRI Conference because it was held in collaboration with KETRI. But now it has evolved over time, and KEMRI now is holding its own annual conference that we call the KEMRI Annual Scientific and Health Conference.
All right. So who are the players and who are the stakeholders that come together?
Right. The main participants in this conference are the KEMRI scientists themselves, but also those that we collaborate with. We collaborate with a lot of people from within Kenya and also from outside the country. Some of our major partners, for example, from Japan, Nagasaki University of Tropical Medicine. They are major partners. We have partners from Germany, the German research funding agency. We have also partners from US. A lot of universities in the US work directly with principal investigators at KEMRI. At this particular time, we have a big delegation from Kansas Medical Center. We have a delegation from University of California, San Francisco. We have other delegations also from Canada. From also others coming from United Kingdom, the Wellcome Trust, and so forth. So it's a big, one big forum where scientists interact from different aspects.
Okay.
And we are talking about leveraging our research findings in order to address universal health coverage.
All right, and for the benefit of those who possibly have not followed up on terms of what KEMRI so far has done, the importance of KEMRI and maybe some of the breakthroughs that we've had in the recent past.
Thank you very much. KEMRI. A lot has happened in KEMRI, and I'm glad also to say that some of these major outputs and innovations and discoveries and also products were highlighted in a documentary that went on air around Christmas and after, and also last Sunday. The documentary was aired in various media houses. But I can tell you for sure that KEMRI has been in the forefront of putting forward research outputs that address public health issues in this country. I'll give you an example. Some of the guidelines that have been used for improved TB treatment emanated from clinical trials that were done with KEMRI's leadership.
Right.
Detection or improved detection of TB itself has come as a result of research that has been done in KEMRI over the last 10, 15 years in order to improve detection of TB, but also to be more specific and taking a shorter time. These are tools that have been developed and tried in KEMRI.
Okay. Now, the government currently is rolling out what we now know as universal health care. And I'm sure from KEMRI, because you deal with a lot of research, what do you see as some of the potential threats to the government achieving universal health care? What are some of the maybe potential threats that you foresee?
Thank you very much. Some of the threats that we see that especially can be addressed by KEMRI include aspects to do with how we roll out UHC, as we call it in short, and especially health financing, health economics, issues to do with availability of effective treatment for various diseases that affect the person on the ground, especially public, primary health care. And those are real issues, because if you look at universal health coverage, we are talking about a package that will be delivered or given to the mwananchi in a bid to ensure that that particular person at the village level is able to access health care that is affordable and effective, to give them, what we call universal health or wholesomeness that goes beyond just taking medicines, but also includes even nutrition.
All right.
As well.
Now, one of the areas I know that KEMRI has been concentrating on, and I would like to indulge you on that, is the area of antibiotics.
Yes.
And let's start with, first of all, do we as a country have an overuse of antibiotics, do you think?
Indeed, yes. The area of antimicrobial resistance is a major threat, and especially to attainment of universal health coverage. Why? Because, as we know, antibiotics, when they were discovered, were supposed to be life-saving medicines. But over the time, they have grown, or they have become less effective because of antibiotic resistance. Bugs or germs becoming less affected by the antibiotics we take, simply because a lot of these antibiotics are overused and misused and abused. And what happens is that when you abuse antibiotics, you don't take the full course, or you use the antibiotics for the wrong treatment, self-prescription, for example, you go to the counter, buy antibiotics and use them. What you're doing is that you're exposing bacteria in your system to antibiotics that are not effective. And therefore, you encourage that bacterium to change over time, what we call mutation, and that bacteria then survives in your system and can be disseminated to other people, either in your household or in the community.
Now, areas that possibly you could highlight, and I know this is from a research perspective. I've read several articles, and for example, some of the spring chicken that we eat, for the farmer who is bringing them up, they sometimes pump them, for want of a better word, with antibiotics so that they survive and they don't get any infection. But does that have an adverse effect on our health later on?
Indeed, yes. Some of the pitfalls in our farming systems over time have been the fact that we use shortcuts that end up with a lot of problems. For instance, if a chicken farmer is raising chickens and they want these chickens to survive against disease, sometimes instead of ensuring that the sheds and what you call biosecurity is ensured for the growing chickens, they will probably use antibiotics, and especially the common used one is called tetracyclines, to add to water and feeds so that they prevent disease. But there is a way the farmer could be trained to be able to ensure that the day-old chicks, as they grow, are kept in a very clean place, and there is disease prevention, and that policy should be the one that should be employed rather than use of antibiotics. Because once those antibiotics are used for those chickens, there are two things that can happen. One, the residues of the antibiotics in the chicken meat itself can cause problems in human health. Allergies, some of these chemicals that are used can cause even cancer, for instance. But in addition, by giving these antibiotics in feed or water for the chickens, you are indeed giving them at a very low dosage, which doesn't kill the bacteria in the system. So you encourage, again, bacteria to become resistant to antibiotics over time. And it's, again, a danger to public health.
All right. Yeah. Is there policy and laws that regulates how this should be done? Because when we leave it to the farmer is out to make profits.
Yes.
But it has an adverse effect, because when you look at the cost, if you put the cost of maybe using the antibiotics that you've talked about vis-a-vis the cost of just keeping the place clean and ensuring that you've done the necessary precautions to make sure that the chicken do not get infected other than just antibiotics, then we risk living our lives at the hands of the farmer who is out to get profit. Is there policy and law that regulates?
Indeed, that's a very good question. We do have laws and regulations that govern use of antimicrobials, both in human medicine and also in livestock. Obviously, there has been a gap in terms of enforcement of this legislation, and especially in the prophylactic use of antibiotics. Way back in 2015, when the global forum on antimicrobial resistance was held as a part of the General Assembly, the UN General Assembly, that issue of use of antimicrobials for prophylaxis in livestock was a major agenda. And what we have done in this country is that through the Ministry of Agriculture, Livestock and Fisheries, we have now embraced what we call the National Action Plan in combating antimicrobial resistance and promoting prudent use of antibiotics. And one of those agendas or objectives is to ensure that farmers do not access antibiotics for use in prophylaxis of livestock. But we need also to observe that animals also get sick and they require antibiotic treatment. But what must be done is that antibiotics must be given to animals when they are sick, but not for promoting growth or for preventing disease. So laws exist, but enforcement must be improved.
And enforcement possibly becomes a challenge, because how then does one ensure that everybody or every farmer is adhering to that? Before we move away from livestock, is it just chicken that we should be concerned about, or do farmers also use other animals, or rather inject other animals with antibiotics for the sake of growth?
I think the most concern really is in intensive farming for poultry or chickens. That's where a lot of antibiotics are used. But also, some of the dangers that exist in livestock farming regard especially treatment or prevention of mastitis in lactating animals, in cows. Quite a sizable amount of antibiotics are used. And sometimes what happens is that farmers are not able to observe withdrawal periods after treatment. So you find a farmer has had the animals treated. Instead of waiting 7 days to sell their milk, they sell the next day, and that's a danger, even for consumers. Another area where antibiotics are also used is in the pig industry. Again, when the piglets are very young, that's a very, very tender age where they are likely to get sick, especially if the environment is not clean. So these are danger zones where we need to observe, again, implementation of legislation regarding access of antibiotics.
All right. Then there's also another area that is of concern when it comes to microbiotics and antibiotics and the use of it, and that is self-medication. Maybe just highlight the dangers of self-medication. We tend to get to a point where, if, for instance, I have a recurrent cold or cough, I get to a point where rather than go to the doctor, pay for a consultation fee, and even just the journey of going there, I end up thinking, he gave me this antibiotic last time, so it should work this time. Is there a danger there?
Indeed, yes. That's a big player, and that's a major cause of antibiotic resistance, emerging and spreading. It's one habit that we as Kenyans, as you're saying, would want really to address, because when you buy antibiotics off the counter, for whatever reason, you are buying antibiotics that you have no idea whether they are going to treat the infection you suspect to have, or they are just going to provoke antibiotic resistance because they are going to encounter bacteria in your system, because every human being has bacteria in their gut system. So those bacteria are exposed to these antibiotics, and probably 70% of the time, probably when people go over the counter to buy antibiotics, is probably a viral infection that cannot even be affected by antibiotics. Most of the coughs, most of the flus are caused by viruses, which really are not affected by antibiotics. So it's a great danger when a person thinks that they are saving money to go and buy antibiotic over the counter. And sometimes, even when they buy, they only take part of the cost and sometimes even share with others.
Absolutely.
So it's a great danger, because all the time you are subjecting bacteria to a dosage less than what can kill that bacteria. And what you do is to encourage that bacteria to spread more, to multiply more, and spread to others.
And maybe just to also highlight the importance of finishing dosage, because with antibiotics, the doctors do insist that you finish the dosage. And there are those I know who possibly once you begin to feel well, you begin to manifest wellness, you do away with the antibiotics.
Indeed. That's a big danger. Again, the reason why the doctor insists you have to finish or complete the dose is because science and research has, of course, proved that when you take an antibiotic for 3 days or 5 days as prescribed, then within that period, you'll have killed all the germs that were responsible for that infection. Now, if you take it for 2 days, you kill only a proportion of those bacteria. The proportion that will remain will have been, of course, exposed to some of the antibiotic and not killed. And those are the ones now that proliferate or grow more and expand the niche for those that are resistant. So it's critically important that the dose that you are given, you complete, and you do not share even with
anyone.
Whether they suffer the same symptoms or not, let them get their own dosage.
All right, we'll need to wind up, sir, and maybe just to go back to the conference that started yesterday and finishing tomorrow, who is invited and who are participants, or is it purely just for those who KEMRI associates with, as you had mentioned, the partners that you have?
The partners that we have are actually in there, not just as participants, but also as presenters. But the conference is open to everybody. And anybody who is able to access the KEMRI website is able to register as a delegate, and they can come and listen and contribute during discussions during this period of the conference. And I can tell you also that this is a conference that is also open even to business people, to people who are social scientists, who want to learn about health systems research, how, for example, in the counties, they can be able to leverage on findings from KEMRI to be able to roll out UHC even at the county level, right from the referral level to the primary healthcare level. This is a conference that is open to all different aspects of public health.
All right, thank you very much, Professor Sam Kariuki, for joining us this morning. Professor Sam Kariuki is the head of policy and research at KEMRI, and we were talking about, well, the KASH Conference, which is KEMRI Annual Scientific Health Conference that is taking place, started yesterday and ends tomorrow. For now, it's 16 minutes after 8. We take a short break. When we come back, we have more lined up for you on this 14th of February 2019, which happens to be Valentine's Day. So guess what's on the menu today on Black and White? Valentine's it is.